Welcome to MasterMined, the behavioral health business podcast. We go beyond the clinical to explore what it really takes to build, grow, and lead a successful behavioral health organization. Each episode features candid, practical conversations with industry leaders, offering strategies to scale your business while staying true to your mission. From branding and marketing to leadership, culture, and compliance, we cover the tools you need to balance care and commerce with confidence. MasterMined is brought to you by Snapshot, a digital agency on a mission to serve with heart, execute with excellence, and build something bigger together. And now, welcome to MasterMined.
Welcome back to MasterMined, the podcast where we explore the minds shaping behavioral healthcare and digital marketing. I'm Jeff Skillen, your insider guide to the strategy, trends, and big picture forces shaping this industry.
And I'm Mark, CEO of Snapshot, asking the questions you're probably thinking. Whether you're a veteran in this space or just curious about what's happening behind the scenes in behavioral health, you're in the right place.
Today, we're sitting down with Drew Rothermel, CEO of Defining Wellness. Drew's been at the helm of some of the most respected names in treatment, and he's seen the industry evolve in ways that most people never see from the outside.
We're talking about how the business has changed, what it takes to lead a high-integrity center in the crowded landscape, and my favorite part, how CEOs make the call on marketing when the stakes are high.
Drew's got insights on growth, leadership, and where the future of behavioral healthcare is headed. So whether you're running a program, working in the field, or thinking about launching something new, this one's for you.
Let's get into it. Drew, welcome to the show.
Thanks, Mark.
Yeah.
Happy to be here.
Great to have you here today. Hey, let's just kick it off. And you've led a lot of companies in the behavioral health space over the years. Like, what actually got you into this space?
Well, if you go back to when I got into the field in 2005, and it was vastly different. It was that's pre-Affordable Care Act, pre-private equity interest in the field. It was reeling from the destruction of managed care, several years earlier, and I had an interest in it because I'm, as a person in long-term recovery, I've been in and around recovery and treatment a little bit, but from a professional standpoint, I was a corporate lawyer. Got out of law school, went to work for a law firm doing middle market M&A work, bank work, etc. Then after about 4 years, I went to work for one of my clients as general counsel of a public company, and this was nowhere on the horizon.
Not in the cards for you.
And through that period, I'd gotten involved on a volunteer basis on their board and committees of Caron Foundation, which at the time was nothing like the Caron treatment centers of today. Mm-hmm. It was much, much smaller, shifting its business model. And, I had an opportunity to go there in a senior role. I had the opportunity to go there as the CFO. And I really wanted to do it. I really wanted to give it a try. I wanted to try something different. But I had a nice life, and I didn't know how much of that I was going to have to give up going into working for a not-for-profit in behavioral health. But figured out that it was worth taking the plunge. And at the time they were concerned. Well, are you going to stick this out, or are you going to just get bored of it and go back to being a lawyer or whatever? And I got into it, and I never looked back. I was hooked from the very beginning. It was exciting. It was it's truly important work, and I was able to make a big difference right away. So that it was just, I can't imagine doing anything else.
Yeah.
Are you trying to say that you weren't making a difference as a corporate lawyer?
I was making a difference as a corporate lawyer for the people I was working for, not necessarily for me. And I have to, so the corporate law experience though was invaluable in that I learned how to work really hard. I learned how to work really hard doing, some fairly monotonous stuff. And it gave me a snapshot as, someone in their mid to late 20s of business at a level that, at a decision-making level that people my age didn't have access to. So it was a really, really good experience from that standpoint.
A lot of people know Caron Foundation as it is now. I think it would be exciting or very interesting for people to, what was it like in 2005?
By 2005, it was turning, but it was small. It was, single site, Pennsylvania, beautiful campus, tons of deferred maintenance from the managed care era. There was the Caron board had brought in a CEO by the name of Doug Tiemann who, had a huge run there. He cut his teeth at Hazelden, and learned a lot working for him, about the business side. He was not on the clinic. He did not come at it from the clinical end either. We had, from a marketing perspective, we felt we had the second most valuable 800 number in addiction treatment, and we did. And,
who was number one at the time?
I would say Hazelden. Hazelden had the best.
I would probably agree.
Hazelden was 10 years older and had the, they had even more, more juice behind their name than we did. But, I know you marketing guys are not going to let us off on that topic sometime during this discussion. But it was filling beds back then was vastly different, and I'm sure we'll get into that.
Yeah. I'm sure we will.
Well, the 1-800 numbers, the old yellow pages, phone books. So times have changed. But Drew, you've seen so much stuff over the years. I can't imagine. Maybe what's one thing about running one of these organizations that maybe people, even some of the professionals, don't really know?
Well, I think that when you go back over the history of the field, or at least the part that I've been a part of, we had organizations with great institutional history, been around for decades. The Carons, Ashleys, Hanleys, Hazelden, Betty Ford. And then you had places that, were smaller, did good work, started by individuals. And those, the folks who founded those types of places were typically clinicians who thought they'd found a better mousetrap. And that works if you got 10, 15 beds and you have good clinicians. But the one thing that I learned through the kind of the many iterations of my career is that the great therapists and great clinicians don't get people sober. Systems get people sober. And, I think that as a field or a bunch of organizations in a field, I think we should all be judged on sort of the worst job we do. How do we deal with those folks who slip through our cracks? And that's why you can take, if you've got the systems, the systems make sure everyone gets the care, and that's kind of the quality. But at this point, a good clinical program is sort of table stakes to get into the game. The real thing is, how are you going to fill the beds, and how are you going to convert the clinical care to money? Those are the pain points. Those are the difficult
So
things to make
I'm guessing
happen.
there's a handful of clinicians out there kind of up in their feelings if they when they hear that. When you talk about a system, how do you mean like the system is going to capture that? Going beyond the clinical model.
So if you have a great clinician, he's got his group of, he's carrying a caseload of 8, 10 patients. What happens when that person goes on vacation for 2 weeks? Yeah. And those 2 weeks are during the 4 weeks that, I've paid for treatment. So how is that handled? Like how does someone move me into their caseload? How do we make sure that all the assessments take place in time? How do we make sure that I don't miss a week of treatment because someone's on vacation? And vacation's actually sort of a bad example because vacations are planned. Let's say someone gets sick or a kid has an accident and has to stay home. So it's that sort of thing. Making sure that, that when there's a problem in the facility, there are systems and redundancies that make sure that care is delivered.
Well, there are studies that back that up. When people are asked about what had the most impact upon their treatment experience, let's just call it what it is. Rarely do they say the clinician was the one that was responsible. It's more often it's going to be the line staff that they have the most impact with.
Exactly. Who are typically the least compensated, the highest turnover, and the least trained.
Yep. But time and time again, it's like you've got to think that they have the most direct contact with the clients that are in your care.
Absolutely, they do. And as a field, we typically rely on 12-step programs to train them to do their job. And that's a great start, but there's a lot more that needs to happen there to have them be effective.
So as you look over the 20-year span from 2005 to 2025, what programs do you feel like have done that well in terms of establishing a system and sort of a catch-all, if you will, where it's quality clinical care, but in addition, they fill the beds and they've also got the system in place?
Well, I think you look at the programs that have been around for a long time, and those places would not be around for 20, 30 years if they didn't have that system in place. Whether they're filling their beds or not, that's another
different conversation.
If you look over the last 20 years, the way treatment's paid for is vastly different as well. And so everything has had to evolve with that.
Yeah, that makes sense.
Drew, when you take over a facility, like you come in as CEO for the first week, like what are those systems that you look at? What are the most important systems that you're going to evaluate and make sure we've got these dialed in, or if not, we're spending some time to get them really dialed in quickly?
Well, Mark, obviously you need your revenue cycle management's got to be tight, but typically I would know that before I got there whether that was working or not. And then I think the big EMR systems are well known, but then the question is how well is it implemented? Because you can get a KeyPoo subscription and you can only be using 10% of the functionality of it, or so there's that. So there needs to be training around that. But I also think that one of the challenges with young programs is that they don't really have a clinical program. They bring in who they perceive to be good therapists who are doing the work they want to do versus the work the facility and the patients need them to be doing. And particularly for in network facilities at this point, you've got a limited time with these clients, so you need to make sure you get get through the basics, and that is, you need a curriculum, a schedule, and you need to make sure that the clinicians are adhering to that curriculum.
Yeah. Since COVID, I know this industry is getting a lot more attention. Do you feel like we're actually making progress, or do you feel like there's just a lot of talk around, what we're doing?
I think we're making progress, but I think and if you look at the numbers, they bear out that there have been a ton of beds added. Over the ton of bed capacity has been added, but when you look at the demand, if you look at how COVID has spiked addiction and mental health issues, the unmet need remains almost exactly the same. Mm-hmm. So,
yeah, is there like looking back over your time, is there like a story that just sticks with you of the impact you've made in one of the centers you've ran?
A story that, I mean, there are a bunch of there. I mean, I have had a front row seat to a lot of miracles.
Yeah.
Like just patients and family systems coming in that you're like, we'll give it a try, but
yeah,
I don't know. But I think that one of the most attractive parts of working in this field is that, I mean, you see one of those every 6 months or so.
Mm-hmm.
And there are a lot of big things as from a business standpoint that I've seen happen. But it's the seeing those just miracle cases, come through that really makes you come back for more.
Well, you said early on that it's inspiring. This industry is inspiring, and I was going to ask you what gets you out of bed, but apparently this is it. I mean, those miracles, seeing those miracles. So,
yeah, I think the miracles. I think I've met tons of very interesting people through working in the field, worked with some amazingly talented people, but it's a unique workforce.
Yeah,
it's different than anything else that you can be exposed to. So and then sort of dealing with some of those challenges as well has been very gratifying.
Mm-hmm.
You've been in a leadership role at a lot of really influential organizations. I'm curious, I'm going to dig back into your history a little bit. What was a big learning curve moment for you? I mean, again, I'm thinking about a corporate lawyer entering this field, and then you said Doug Tiemann was a mentor to you. So what about some other learning curve things where you really felt like you took some major steps up?
Well, I think the big shock was, I came into this from working in a big bank where banks by law have to have all kinds of systems. So there's you've got all kinds of systems, risk management in place, et cetera, which from a lawyer's brain is a really good thing. And then I got into this, it's like, well, these places don't have and I was working for Karen, who had kind of the best out there, but it was still like generations behind what I'd seen in other businesses. So that was a big shocker. But it was also an opportunity because we were able to implement just sort of some basic business stuff that really supported the growth of the clinical program, helping more people, et cetera. So that was one. And then I would say the second part was then, kind of going from the not-for-profit, building something for the next 50 years to for-profit and private equity backed, where, you need to come up with a plan that you can execute in 3 years basically.
I'm really glad you brought that up because in a previous episode and even in future episodes, we've spoken about programs that are built to last and programs that are built to sell. And I think that's sort of getting into the idea of a nonprofit versus a for-profit situation. If you've been on both sides of those for an extended period of time, maybe you can dispel some of the thinking or the myths or the rumors around what's the value of a nonprofit structure and then what's the value of a for-profit structure.
At first blush, the response is, well, not for profit, you don't have to pay taxes, but that's kind of a minor part of it. I think with a not for profit, you have the luxury of time. You have the luxury of time. You have the luxury to build something that's going to be around for a long time. You have a lot less access to resources, and you have a lot less access to talent. So, which is good, which is fine because you have the time to build. And with with the for-profit, you need to come up with something that you can generate rapid growth within 24 to 36 months, and that's a different situation when you're trying to develop real estate and grow, develop real estate, develop brand, develop a census. Like that's not a lot of time to get
right.
all that stuff done. And I feel like I've lived through like 4 or 5 generations of this field in a relatively short period of time. But it's changed a lot. And I will tell you that without the injection of private equity interest and investment in this field, we would be in a really bad situation because there's no way the business models that were in place before PE was injected into the field, there's no way the capacity expansion could have ever occurred.
So, I guess my takeaway from that is that largely I'm hearing the difference between a nonprofit and a for-profit is the time span that you have in order to build something and then deliver results, and then you're accountable to a different organization, right?
Time and resources.
Time and resources. Mm-hmm. All right. And then you also spoke about how it's changed from when you got into the field from 2005 until now. So over that 20-year span, do you have sort of like eras that you have in mind in terms of the evolution of the business as you see it?
Yeah, I think, and then I would also, there's the other sort of class of ownership that I would throw in there is the recovery entrepreneur. Mm-hmm. The kid from a well-off family that gets sober, has family resources to buy a couple sober houses, then starts an IOP, and we're off to the races. So you've sort of got that class, and then you have folks who have just identified this as an incredible way to make money, and that's like another group.
That's a whole.
That's another group we can talk about. And there was definitely a lack of regulation early on that created loopholes for abuse, and we've all seen it, and the field suffered from that. We still have we still have reputation issues compared to the rest of healthcare.
Well, we were sort of joking before we started recording about back in the early days. We talk about a tech stack, and a tech stack back when you started was a stack of index cards, basically, right?
Index cards and yellow pages, yeah. And there were people doing very, very well with that, very, very well. But if I go back to your question as far as what were the like kind of the many eras within the time
Yeah.
that I've been there. You know, I was telling you before that literally the first day I started in this field, Sierra Tucson, it was announced that Sierra Tucson was sold to CRC.
Mm-hmm.
And, you know, there had been some private equity involvement and some poking around, but that, you know, having such a premier brand sold to private equity was really sort of like kicked it off, you know. So, you know, during that period of time, you know, it was really like out of network wasn't even a big deal. It was really cash pay. And when I was at Cairn, we had, you know, however many 100 beds, and we were filling them with, you know, people that were paying $1,000 a day to be there. And then, you know, we had a scholarship fund to, you know, help those who couldn't make it, you know, couldn't cover it. But that model has changed drastically. Like that model doesn't, and a lot of places popped up with that model. But then with, you know, Parity Act and Affordable Care Act, you know, all of a sudden young adults could stay on their parents' insurance policies for longer, and they had to cover the care. And, you know, if you look at just sort of the health insurance business in general, like out of network was never designed to be a business line. It was for, you know, you had your insurance, you had your bunch of doctors, and if you had some specialist or something that you needed that wasn't in on the panel with your payer, you could go and you could go to an out-of-network facility. It was never designed to be like someone's a facility's sole source of revenue. So, you know, then the model moved to, okay, instead of just all cash pay, we're gonna take your out-of-network benefits plus a number, which put a ton more revenue and opportunity for care in the market, which is a good thing. And then the so that was, and then that model went on for a while, and then folks just gave up on the extra cash because the out-of-network benefit was so great. And I mean, there was a lot of excess in the field. And then the other thing that happened that I saw happen during that period of time is that, you know, when I got into this, it was sort of at the tail end. But if, you know, if someone got into recovery and then decided they wanted to work in the field, they would get a job not in the field, maybe go back to school, and then they have a job as a counselor. You know, go to the Hazelden Graduate School, one of those, you know, type things, and then they would get a job as a counselor in the field. That then morphed to as the out-of-network benefits and the cash that were available grew. All of a sudden now, and it became harder to fill beds. So I think probably in the beginning, a salesperson in this field was compensated about equal with a counselor. But then all of a sudden, you know, the marketing model vastly changed, and all of a sudden, the marketing position was worth, you know, 50 to 100% more than a counselor's salary. So then you'd be like, well, I don't want to deal with patients. I want to get paid like that. And then the whole gap between someone entering their personal recovery and working in the field shortened, and in places like, you know, South Florida, Austin, Southern California, huge recovery, you know, footprints. people get into a sober house after treatment. Within a couple months, they're the night manager at the sober house. They're working in the field, and then they've got a job as a marketer, and this is, all in the course of, 10 to 18 months. And the challenge that you saw is that, like, these folks were just barely starting out their personal journey in recovery. And there were, spectacular problems throughout the field as a result of that.
Yeah. Well, I mean, we may want to just keep going down this path because I'm glad you led us into it. But fast forwarding to today, you're leading Defining Wellness, for-profit behavioral health company. And I guess now, like, just thinking on the track of marketing, like, how as a CEO are you, like, where do you see marketing playing a role? Like, what's the value of marketing in your eyes to really help drive everything you're doing?
Well, I think I wish I had a pithy soundbite for you on that one, but I think that's a complicated answer. As you go from sort of this out of network, and I think for those of us who were in the field, there was a conference in South Florida in, like, I think Lee Pepper had a lot to do with it. That in South Florida in probably maybe 15, 16, something like that. And it just felt like that was the end of the out of network.
I remember it well.
Yeah.
So the conference was Moments of Change.
That was it, yes.
At the Breakers.
I was going to leave that out. But go for it, Jeff.
No, there's a long history about, and it's like that's a whole other podcast topic in terms of conferences. But you could definitely feel a shift in the business.
Right. And so one of the benefits of private equity coming into the field for sort of everybody involved, except for, like, maybe some of the sole owners, it was that everything's been professionalized. Everything looks a lot more like healthcare. But with that, the margins have compressed, and there's very little investment interest in anything other than in-network care. So that gets to your point of from a marketing standpoint. At in-network rates, your facility needs to be full. Like, you can't operate without it being consistently full. So I think that gets to my earlier point of, your clinical care is table stakes. You are generating a lead funnel that you can fill your business is very, very important. And then on the back end, getting paid for it is really important. And they're both very complex, expensive things that require patience as well.
Yeah, I'm glad you said that. And you touched on it earlier about just systemizing everything you're doing within the, within the company. And I think that's what we see a lot of times when Jeff and I step into, an organization. I mean, the first thing that we try to do is operationalize the marketing function within one of these treatment centers is, pulling everything together. And we've talked about it, and we'll continue to talk about this in future episodes, but just pulling it all together where you have different views for different stakeholders within the organization, from, the CEO needing the numbers on, conversions and how many of those turned into patients that, to, marketers that you're looking for a lot of different type of data that are going to help us drive what we do next. But for us, just knowing, are you building it to sell or are you building it, to last is also another important thing. Because, as we step in and provide some of these, marketing functions. I mean, our job is to really drive, leads and opportunities within that will become new patients and meet those patients where they're at their, time of need. And so I'm glad you said that.
Yeah, I think, and to your question, are you building it to sell or are you building it to last? I don't buy the fact that you can build it to sell. I mean, you may build it to sell and you may find a sucker to buy it, but you need to build something to last to create and retain the value.
Yeah, I think that's important to say too, because we have talked about that, build it to sell, but I mean, really, like what we talk about is building a sellable business, which is actually a business that everybody wants to run and probably run forever, because you're making you're doing the job that you need to do, you're making the impact that you need to make, but you're also making the profitability that it takes to grow and scale the business.
Well, and Jeff and I were having the conversation on the ride in that there's definitely confusion in the marketplace about what is a business that a lot of successful treatment organizations in all different shapes and forms, but there's definitely you have to know what you are. Are you a scalable business that is going to be sold at some point, or have you created a really good little business that you should ride as long as you can? Because a lot of times those really good smaller businesses provide a great living for the owner and the management team, et cetera. But the pain involved in converting to a scalable PE-backed model is very significant. And I would argue that there are ways that the founders and owners of those businesses can have just as great a quality of life, wealth creation, et cetera, by sticking to what they're good at versus trying to move into that into the scalable PE-backed model.
Yeah. Well, it would strike me that one of the biggest challenges that you would have, Drew, as a CEO, is managing and keeping in alignment all of these various forces, right? So you have maybe the investment perspective, you've got the operations perspective, you've got the revenue perspective, the marketing perspective. What is your approach to keeping all of those various aspects sort of focused on the same goal and in alignment?
It's a lot of balls to keep in the air.
It is, yeah.
But I will tell you that I know at one point you wanted to talk about staff development.
Yes.
And one of the challenges in a 36-month time horizon is you don't have time to develop staff. I mean, you need to get people that know the job and do the job. And typically those are folks that are very focused in their particular area of expertise. So you've got, kind of your finance team with one mindset, your billing team with one mindset, the sales and marketing team with one mindset, and then the clinicians who are actually clinicians and the tech staff who are actually doing the work with another. So it's trying to bring all those groups together to understand. And I think that the one thing that I try to impress upon the clinical staff is like, hey, if we don't have any patients, we don't have any paychecks. So causing friction with the admissions team is not necessarily the smartest move. And then on top of that, I think that the ecosystem of a treatment center is a very fragile thing. I think like the analogy of I've got like a bird's nest with a couple little baby birds, and I've got to go for a run with it and not drop it is sort of how I think about it sometimes. And there are so many different levers you can pull to get what you need. We get to where you need, but a bunch of those levers are going to make you drop the bird's nest, and then it's really hard to put it back together. Yeah, I mean, I think that is the CEO, the CFO, if you have a chief operating officer or the executive director of a particular facility, need to understand like kind of the balance of all those competing factors.
Yeah.
So Drew, where do you think this industry is going?
The needs here, I don't think it's going anywhere. I think that we have seen a bunch of different models come out that are attractive to payers. I don't necessarily think they're attractive to families who are looking to get their loved ones well.
So you feel like maybe we're a little out of right now. If you were to look at the scale, it was like it's heavy on the payer side right now, right? In terms of dictating care.
And it always is going to be. When you look at the size of there's not a single treatment organization in the country that really has leverage with a payer. I mean, these things are huge. Mm-hmm. But there are ways around that. But I think that during COVID, the online care, like that became it became a big thing. It was all in vogue. The therapists love it. They can work at home in their footy pajamas and everything's good. But with the severity of the patients that I've seen throughout my career, not one of them is going to do well in a virtual care setting. So while there may be some benefits to it for aftercare, I firmly believe that sort of the residential detox and residential care is never going to go away. I mean, I think that is I think that it's the only way for a certain level of patient to get well. It's and the insurance companies are going to continuously fight to deny admission to it, push to outpatient, step down early, and I sometimes joke around that we all know, like, longer term care is good care, but in an in-network facility, 90-day care is coming through 3 times. That's the only way you're going to get the time.
Mm-hmm.
Yeah. Well, what is just staying on that path? What's one thing that you look forward to in the future? What's one thing that's got you excited about where we're heading?
I think the fusion of mental health care with SUD treatment is there's nothing major there, but when I go back and look at how it's evolved over the last 20 plus years, it's really amazing how much better we've all gotten at this than we were. Not to say that, like, sort of the basic stuff that Hazelden and St. Mary's developed with the Minnesota model is like the Minnesota model will never go out of style, but the changes to the Minnesota model over the years and the evolution of it has been, really, really impressive. And if you go back to the founding of that model, the premise was that there's way more we don't know about this than we do. So we have to always be open to new advancements.
Yeah. What's one of the things of being a CEO of a treatment facility that, what's one of the hardest things about being a CEO and maybe like, were you prepared, or do you feel like you were prepared getting into it?
I think, managing, moving that little bird's nest around is you have staffing is very hard, and you can lose control of your staffing quickly, and just sort of keeping the right folks in the right seats for the right amount of time to do the job is critical. Because if you don't have those people, you're not going to be able to deliver on the care that you're promising.
Well, I'm thinking about our listeners and the people who are watching this episode, and you're enjoying a tremendous professional career in this industry, Drew. What would you say to somebody who might be listening and just saying, what should I be doing in order to enjoy that kind of a career trajectory? What advice would you have for somebody who's trying to get into this field and do it for all the right reasons?
Be very lucky. I think first of all is examine the reasons, because it's easy to pay lip service to I want to do it for the right reasons, but the sort of the personal toll it takes, just kind of sort of making sure that you continue to do the right thing even when it's the really hardest thing to do. I'd say mentorship is huge. As a field, we do not do a good job of growing talent. The bright shiny objects that you meet at conferences, that's not where the work gets done.
Yeah.
Like that, if you want to have, don't do it as a salesperson. Learn the business. Learn whether it's on the operations side or on the clinical side. I worked with a guy at Karen who was, probably the best treatment facility developer you can imagine. I mean, and this guy devoted his like he didn't know anything about clinical care, but he knew how to, get a facility open, looking exactly like you want it to look, with all the, support in place, for the amount of money he told you he was going to get it open for, and so there's all kinds of opportunities like that. New systems, AI is going to have a huge impact. And I know we've talked about that from a marketing standpoint, but
it's going to have an impact on an operation
just
standpoint
from,
too.
yes.
You mentioned the mentorship. So what advice would you have somebody in terms of like finding that mentor? I agree with you that as an industry, we do a pretty lousy job of bringing up the next generation. And for me personally, that's something that I would like to see change and maybe even play a role in that. I mean, how would you say that we could address that?
Well, there are a couple questions in that, but I would say that
I'm expecting you to have all the answers.
For someone that's looking for a mentor in the field, I'd say first and foremost, find someone whose values align with yours. Mm-hmm. First step. And then find someone that's built something that you like, something that you respect. I think that I've found that people in this field are extraordinarily generous with their time if asked. Mm-hmm. Develop the relationship.
Very good.
But as a field, then the second part of that question was, as a field, what would you do? And I think I think these conference providers have sort of been driving a lot of those processes of how we interact. The conferences are dominated by untrained sales and marketing staff, which is not how we should be leading. That should not be what we're leading with as a field.
Yeah, what I took away from that, Drew, is just just go out and ask for a mentor. And I think I see that in business across every industry is either one, a person's ego may be too big that they don't feel like they should ask, or they just are nervous to ask. And I'm glad you said that. I mean, people in this industry especially want to help. And so your advice to other CEOs that be listening to the show would be just find that person and ask them. And chances are very positively that they would step in and help you mentor.
Yes. And the other thing I would say is that if you've been around the field for long enough, your ego gets ground down pretty quickly. So I think, I would say I am probably more open to feedback and new ideas now than I was when I started, just because, it's hard. There's sort of no pride in authorship or an invention, and if you've come up with an idea that works well, I'm happy to adopt it as my own.
Yeah,
and give you credit for it.
All right, well, let's change the vibe just a little bit. So I've just got a couple of quick fun questions for you, Drew. So if you weren't running a treatment center, what would you be doing?
I think that if I was not running a treatment center, I would be spending a lot of time outside, and I would still be helping anyone who asked connect with the resources they need to get well. Something I'm happy to do in my free time. So that would be it.
What's Drew? What's a book that you've read that's helped kind of shape the way that you lead?
The book that I've connected with most on in as far from a leadership standpoint is book called Extreme Ownership, which is written by some Navy SEALs about their experience in securing Iraq. And it's great. And, that was one of the first things I did at Defining Wellness was we bought everybody the book, and our leadership team meetings for the first several months were a chapter of that book each meeting. So I really like that. And then for there's another one that it's sort of a dummy's guide to private equity, and it's a short read, but it's a fantastic outline of everything you need to do, like sort of how to cover everything you need to do as a private equity CEO coming in, and whether it's your fourth time or your fifth time, or your first time or your fifth time, like it's a great starting point to figure out how you're gonna spend your next 3-4 years.
Yeah.
Here's our last one. Okay.
So
our last fun question: what's one assumption about this industry you wish you could change overnight?
It would be payers need to pay for treatment.
Mm-hmm.
And they need to pay. They need to pay at a rate that allows for more than adequate treatment. Probably doesn't have to be the best in the world, but it needs to be staffed to a point where it's safe. And what I have seen is that with sort of unscrupulous operators, staff down, staff down, staff down until you have sentinel events occurring all the time. But now they've set the bar for the rate that that facilities are willing to accept, and it hurts all of us.
Drew, one of the things that I think you are really well positioned to address is just the evolution of marketing in this space. I think about what has happened in our industry over a 20-year span, and then what's happened in our society over a 20-year span. We talk about the Affordable Care Act. We also talk about just how we consume information and how we actually make decisions. So, what is your perspective on that?
Well, it's been a real journey, and I think my brain flashed back to when I started working at Karen. At that point, I had a flip phone, and I had a house line at home, had a personal computer at home, and when I got to Karen, everyone had BlackBerries. So we all got BlackBerries, but BlackBerry could do some email, text wasn't a big deal.
Do you have a beeper?
No beeper. Really couldn't. No, but I think a lot of the clinical staff
they still
did.
had pagers, right? Yeah.
And but you really didn't have handheld internet per se. And at that time, Karen had an extremely valuable 800 number, and that number was everywhere, and we got a ton of business from that number. The other and we had a website, but no one really knew. It was a couple pages. No one really knew what to do with it. The other group that held a lot of sway at that time was an organization by the name of AIS, which was the Association of Interventionists. And if you were a private pay facility, they owned you. And particularly if you didn't have a great 800 number, you needed the patient flow from those interventionists. And I remember 2006 maybe, went to the AIS conference in California, and you just basically there was no, they had all the leverage over the treatment centers, and everyone was writing huge checks to sponsor this conference, and I think some of the interventionists figured out the internet a little bit faster than the treatment centers did. So they were generating their own leads, converting them, to interventions, and then you try and get the referrals. And we talked about sort of before that the Yellow Pages marketing, where you figured out the folks that did it well and profitably. They figured out where the rich insurance policies were most distributed. So then you buy Yellow Page ads in those zip codes, and that worked well for a while for a bunch of those places. But I think that particularly for the old line places, Karen, Ashley, Hazelden, Betty Ford, having the field shift to the point that it wasn't just your name anymore that was going to get you calls, because anyone could open a treatment center and on the internet make it look like it's the greatest place in the world. So that's when things really shifted.
So, you're right at this intersection of brand-related marketing versus results-oriented marketing, right? Mm-hmm. And so when did you see that shift sort of happen, and then how do you view that now?
Well, I think, I remember when I was at Karen, having these discussions about this marketing stuff is really expensive. We don't want to really have to pay for this, and there was a pretty big sentiment in the room that we deliver really good care. People should just come because of that, And I agree with that, except at that point it was, this little thing called the internet was really taking off, and we weren't we didn't need to jump in as quickly as others did. So there was a dip, and then figured it out. But I think the biggest challenge was, okay, now we're going to commit a portion of our business to internet marketing. And this is before there was social media, so you weren't looking at any of that stuff.
Yeah.
But what does progress look like, and what does success look like? And those things were not clearly defined. No, people just didn't know what it was going to take to get traction, and then I think a lot of places got stuck in just sort of the most dangerous loop of, okay, I'm paying this firm a ton of money. We're 5 months in. They're not getting me what I want, so now I'm going to change out. And then I start over, and I pay those guys. So it was just this cycle of wasting money and not waiting for the results to happen.
Mm-hmm. So how does a CEO make a smart decision in terms of who to partner with for marketing services?
I think this really falls into like my comment earlier about mentorship. Mm-hmm. Is like you need to find someone you trust, someone who has the depth of experience, and it's not simple. It's not simple. It's very complex, and so can articulate the complexity and show how how it's gonna work. But there are a lot of bad providers out there. And at one point, there was I think Wharton was offering an executive MBA program on digital marketing. I was about to do it because I said to myself, I'm the worst consumer of digital marketing. Whenever I meet, it sounds perfectly good to me when I meet it, get the sales pitch. I just don't know how to evaluate it and ask the right questions. And over time, Jeff and I have worked on 3 different projects at this point, and it's about putting the resources in place, and then giving it the time to work.
Yeah, and you mentioned taking it back to mentorship. So, are you looking for your agencies that do the marketing for you? Are you looking for them to help educate not just your team of marketers, but also the CEO and the C-suite of people?
Yeah, I think that's really important. And with Snapshot, we have an hour-long call every 2 weeks to really dig into what's going on, and ask a lot of tough questions. And then I think that the sort of how do you go about picking your resources? I think you need a friend with knowledge. I mean that really is and I remember this meeting, and Jeff had set up a meeting with Lee, and
yep.
I think it was at that hotel in Nashville, and yep. Just really went over, and we spent a ton of time going over what does a comprehensive program look like, and the challenge is that if you a lot of people are saying, okay, I like that, but I only want to pay for 80% of that. Well, paying for 80% of it doesn't mean that you're going to get 80% of the results. It may mean you get 30% of the results.
Mm-hmm.
There's a reason it's a comprehensive program.
I mean, Mark, picking up on the question that, you bounced back to Drew. I mean, Drew, one of the things that Mark and I deal with all the time is that our world of digital marketing is changing so fast. And then the clients that we work with and the programs that we have the opportunity to work with, educating them on how fast it's changing, when a lot of times some of the decision makers, their knowledge is dated. Their information is dated, and they're looking at it almost from a lens of like what worked 10 years ago. And we're looking at a world where stuff is changing literally every day, every week, every month. So, I mean, what can we do to help bridge that gap?
I think communication is the key part, and it's more than a spreadsheet a month. It's like explaining here's what we see coming. Here's what what you need to be ready for, and then also I think for like a digital marketing firm, like you're one piece of the puzzle, and then you've got sort of the boots on the ground sales team and the call center. And Jeff and I have been through this before. Is you can build the greatest funnel in the world, but if you don't have a call center team that can convert that, if you don't have the skill set and adequate staffing in a call center, you're not going to convert it. Yeah. And then you're really wasting money because you've got great leads out there that are never going to materialize into admissions.
I'm glad you said that. And I mean, I think, you expect it, all of our clients expect us to bring new ideas. And, what I've seen from some of the agency world in this space is that they may have one treatment center or two that they work with versus 10 that they can share like best practices across this. Because again, like, the mentorship, it's like, everybody wants to help each other, give care to the people that need it. And so, we're able to bring ideas that we see that's working in North Carolina or that's working in California to, all of our clients. And so I'm glad you mentioned that. But I just know the expectation is higher than ever for us to really be able to come in and provide ideas and strategies, and especially now with AI, all the clients are expecting, how are you using it? And, how could we use it? And what should we be looking for?
Right.
I think a lot of CEOs, when they see stuff like this, they see disruption in the marketplace. And you just described going from yellow pages to internet. Okay, period of disruption. Do you see that as a point of fear or a point of opportunity? And you could look at AI as sort of a same situation here, where more disruption. Do you see this with fear or with opportunity?
I think a little bit of both, and it depends on the day. Because one of the challenges is when these, it's really tough to keep a treatment organization on a strategic footing versus a reactionary crisis footing. And when you're in crisis mode, I don't want to hear about AI and what's going to happen. It's trying to focus on how do we get ahead of this, and then that's part of the challenge in the PE backed 36-month time frame is like that's great on my next investment, but not right now. So it's
equal parts both.
It can equal parts both for sure.
Okay,
yeah.
Gotcha.
What's one thing out there that you've seen generate opportunities over the years that maybe surprised you?
I think there are a bunch of them. As we're talking offline, when I was at Origins, we had the opportunity to be on the Dr. Phil show a bunch, and there are a lot of sort of those media opportunities that don't really amount to much, but that was one that had great value, so that was, but that's sort of a one-off opportunity. I think that facilities have facilities that are providing good care, because they're providing good care, get good and unique opportunities, whether it's, tied to, a big police force or a big company or a VA hospital or something like that, where, because they got the results with someone that really mattered to the decision maker in that organization, they, get a real steady stream of business out of it.
Yeah, I think this just goes back to our listeners out there. And we've talked about this in numerous episodes, where a marketing plan is really need to be tailored to your specific program and what you offer, as opposed to just doing what other people have done. So like in Origin's case, the Dr. Phil appearance made a whole lot of sense. That avenue's not going to be open to everybody, nor should you kill yourself to try to make that opportunity happen.
Right.
And opportunities like that can get shut off at any time too, which can devastate the business.
It's not something to build a business around now.
That was an eye-opener. I love it when someone like Drew, who's clearly seen a lot, still comes across as grounded and forward-thinking.
Absolutely. I mean, what stood out to me is how intentional he is about aligning marketing with values, not just metrics. That's something that more leaders in this space need to hear.
If you enjoyed this episode, make sure to follow MasterMined wherever you listen. Apple, Spotify, you name it, and share it with someone who's in the trenches of behavioral health.
We've got more great guests lined up, from data disruptors to clinical visionaries, so stay tuned and thanks for joining us.
See you next time on MasterMined.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.